with Dr. Vanita Zahn.
Long haulers, the term for people who, even after they recover from COVID-19, continue suffering symptoms. And now some little known illnesses are being diagnosed in a growing number of these folks. So what does that mean for their health? How to get diagnosed properly and treated? What are the implications for health care? Well, Dr. Joshua Shulman-Marcus, a cardiologist at Albany Med, is my Health Beat guest to discuss all this. And good to have you with us.
Hi, thanks for being here.
Yeah, one of the things that's happening now is chronic fatigue syndrome we're seeing with patients and some other illnesses in that vein. Share with us what you're seeing and the concerns this poses for these long haulers.
Absolutely. I mean, I'm a cardiologist, and the biggest issue we've been seeing in the cardiology world for a lot of these patients are that I see of mostly palpitations, feeling that their heart races very easily from even simple activity, and feeling faint when that happens. And this can happen even in people who were in very good shape before this, who had, were physically fit, going to the gym a lot. Younger people, more likely to be women, but I've seen a few men as well. And it's very distressing to them because they were used to being in great shape, and now they feel very debilitated even doing some basic things. And this sometimes with chronic fatigue, sometimes just this cardiac symptoms alone.
You're talking about something known as Postural Orthostatic Tachycardia syndrome, POTS, which is not, in the past, hasn't been easy to diagnose.
Right. So I think that, it's unfortunately the problem with this world is that it's been understudied or hard to pinpoint what is going on. But POTS or POTS is unfortunately somewhat common diagnosis, generally in younger patients, more likely women, where their heart rate just accelerates very quickly from basic stuff, but their blood pressure doesn't change. So that's what makes it distinct from, say, being dehydrated or being very anemic or something like that. We think it has to do with the autonomic nervous system. It's not always been well characterized, but now because of post-COVID, we see so many more people with something similar. It's causing more studies to be done and a lot more people to be presenting to care. So we have to really pay attention to some questions that we've sort of brushed under the rug for a while.
So what is the treatment?
So the treatment, based on my discussion with other experts, is a combination of lifestyle and then maybe some medications. The lifestyle is mostly very excessive basically hydration, actually having more salt intake. And I'm a cardiologist, I don't say that very often, but the selected people, actually more salt. Compression, not just in terms of compression stockings, but even abdominal compression, abdominal binders, which can make a big difference. And then exercising protocols, which the person is mostly supine or lying flat, like an exercise bike, or rowing or swimming, to get muscle strength back up, but not being upright so that they don't get as tired and their heart rate going so fast. A combination of these things seems to work reasonably well in many people. We actually working with our physical therapy department to try to help them out, to influence it further. And then there's a medicine side. There's a bunch of medicines, none of which are very well studied. We've tried a few medicines to increase the amount of fluids in your body, medicines to raise your blood pressure, and some medicines to change your heart rate.
Does POTS pose a life and death risk? Or is it something
no, that's
not
right, but it can be severely debilitating. Most of the people that it affects seem to be younger. I mean, I've had now in the post-COVID world, I've had many people who were nurses who got exposed, especially early on in the epidemic, social workers, other people who worked in the hospital. Many of them had very mild illness, and they feel they can't even go back to doing their job. So I mean, it's not life-threatening, but it's extremely life-altering.
And that's an important point you just made. You did not have to have a severe case. You may not have even been hospitalized with COVID. It may have been just a brief brush, and yet you can experience this. At what point after you've recovered will POTS rear itself?
It's a great question, but I think that the first few weeks after COVID or any major viral illness, you might still be recovering just normal fatigue, but if symptoms are persisting, especially the tachycardia, feeling the heart rate's running very quickly. And these days people have all these Apple Watches and stuff. They actually can show you, like on their phones and stuff, that this has changed, especially after a month. And we should do an evaluation. It may not be POTS. It may be what I call POTS-esque, like a light version of POTS, which has a formal diagnosis to it. But I've been treating them similarly.
You are. So get this checked out. Now, I should also point out, Albany Med has a long-haul clinic.
Yeah.
Are you seeing patients with POTS in that clinic now?
Yeah, so the way it works is the entryway is in our pulmonary division, and if they think that there's something based on their evaluation that merits cardiology, I'm the main person they've been sending patients to. Sometimes we have to do tests and sometimes not. Honestly, at the beginning of the epidemic, this was not anticipated that this was going to be the major cardiac issue that comes up in post-COVID patients, but it is, and it seems to be affecting a fair number of patients. The other thing about it, interestingly enough, is that one thing that has helped a few patients out, weirdly, is actually getting vaccinated, even though they had COVID already. And no one knows what to make of that. But it does mean that even though if you've had this, that we still encourage people to get vaccinated, because there is a small chance it actually might make you better.
And it's not only with POTS, is it? They're saying that if you get vaccinated post-COVID, and you have other long-haul symptoms, it's helping with that as well.
Correct. I don't know what to make of that. It's all anecdote. There's no literature yet out on it. And that's the other thing about this diagnosis in general. A lot of my patients I encourage them to be active in the online, fora, because, the treatments and the ideas that are coming out are way outpacing the established medical literature. In some ways it's dangerous to do that. It's better to use real science, but patients are suffering right now, and I've had one patient at least come to me and said, I read this online, other people who've had it, can we try it out? And I tried it and it worked really well for her. I mean, she's going to go back to work. Yeah. So I'm always open to new ideas as well on this.
Before I let you go, and if I'm throwing you a curveball, just let me know. The concern about myocarditis in children who are vaccinated, is that self-limiting? How sick are they? A lot of parents are concerned about vaccinating their kids, particularly boys, it seems to be, who are hit with this.
Yeah, so I've seen at least 2 patients with this now. So it's a legitimate thing. I don't know how to predict it. Both recovered completely and have no symptoms. One was a man, one was a woman. Both in their 20s. Obviously, I've reported both to the CDC. Hopefully we'll get more guidance about that. I think it's something to take into account. I think it's a plus minus. I really would wait for more information from the CDC, weighing, vaccination versus not, if there's specific risk factors, if this specific vaccine or vaccine dosing that needs to be adjusted. I'm not really sure, but it is a legitimate thing. I wouldn't make it paralyze you, but it's something to at least consider. Consider
enough, and a lot of parents are pointing to that and saying that's why I'm not going to vaccinate my children.
I'm not going to say one way or the other. My opinion on that is not an unreasonable thing to be worried about. Versus a lot of other things in the COVID world that were unreasonable, this is something that I think that we still are learning the data about. I don't think it's very common. I mean, many kids have been vaccinated with no problem, but it is something that we need more information on. Need to keep an eye on it.
Doctor, I have a feeling you and I are going to be in touch again as we move into the winter months and numbers continue. Also, the one other thing before I let you go, is it more women, if I'm not mistaken, who have been diagnosed with POTS, and because too often women are sort of waved away and they're told it's all in their head?
Yeah, so one of the issues that comes up with this, and this is, I realized myself I made mistakes on this in the past, is that women are more likely to be diagnosed to have this. There may be reasons biologically why that's so. It's not really clear, but there's been a tendency to sort of pathologize these patients as being anxious or depressed or histrionic or something like that, and just really blow them off. A lot of cardiologists really don't like to take care of them because the treatment is kind of challenging, but they should not be blown off. This is not like just some sort of in-your-head psychology. It might be in your head in terms of dysautonomic nervous system, but it's not some sort of like a psychological thing. But people then reasonably start to feel very isolated and depressed, mostly because they're impaired and because no one's taking them seriously. Yeah. And so I hope that as a result of all this, we get to have better treatments for POTS, but also a greater willingness to try them.
Well said. Paternalism really has no place when it comes to healing, does it?
No.
Dr. Joshua Shulman-Marcus, a cardiologist at Albany Med. Thanks so very much. Look forward to chatting with you down the road as we learn more about this. And just a quick reminder that if you just check out the link section here at WNYT.com, we've set up a link so that you can get more information and access the long-haul COVID clinic at Albany Medical Center. It may take a while to get an appointment, but they are there. So check out under links. Thanks so very much for spending time with us. Stay well. We'll see you next time.